first of all, I would like to introduce Professor Chai. That he got his PhD and MD from Seoul National University College of Medicine, and he's been working on the parasitic disease in Asia, especially in the Greater Mekong subregions and also in Africa. And he has published more than like 600 research articles and contribute more than 30 books and book chapters. And today, he's gonna share with us some of those experience and some of those researches. And his title today is The Parasitic Disease in Asia, the Neglected Story. So please be reminded that the meeting, Professor Chai would have a presentation for about 1 hour without any interruptions. And then we will allow the question and discussion later. Okay, please mute your microphone and enjoy the meeting and enjoy the talk, please, Professor Chai.
Yeah, thank you very much, Professor Sutas. I'm very happy to give a seminar today. It's very important beginning of this tropical medicine seminar. And I would like to thank Professor Van Chop also for his organization of this important meeting. I will use some PowerPoint slides for my talking. So I will give this prepared. Okay, can you see this?
Yes, right there.
Okay, can you see this one?
Yes.
Yes.
Yes, please.
Thank you. Parasitic disease in Asia, it is a largely neglected group of disease. So I would like to summarize some views from the point of neglected tropical disease, particularly parasitic disease in Asia. So neglected tropical disease, briefly NTDs, particularly parasitic, is 12 groups are included among the parasitic NTDs. And in Asia, we have a 9 group of disease. For example, Schistosomiasis, Leishmaniasis, Lymphatic filariasis, Dracunculiasis, soil-transmitted helminthiasis, and foodborne trematodiasis, Taenia and cysticercosis, Echinococcosis, and scabies. These are 9 kinds of parasitic entities in Asia. And in Africa and America, 3 more parasitic entities are prevalent. That is the trypanosomiasis in Africa and Opisthorchiasis in Africa, and the Chagas disease in South America. NTDs, it is result in the death of people each year, at least more than 142,000 deaths, for example, in year 2013. So I would like to talk about this Asian group 9 disease, but among them, the red one, 1, 2, 3, 4, 5 groups, I would like to mainly mention. Okay, parasitic entities have been largely neglected from the national and the global health authorities, mainly because they are mostly chronic, long-lasting disease. It is not acute and not so fatal disease in most cases. It goes on chronic and chronic course of the disease. And the pathogenicity and the mortality are generally low, except in a few instances. For example, you have seen the movie before, just before, the Opisthorchiasis viverrini infection causes the cholangiocarcinoma cancer. So it is not so low pathogenicity, it is high pathogenicity, but many kinds are generally pathogenicity and mortality are comparatively low compared with other diseases like malaria or AIDS or many others. And the infected group are mostly rural people and low income people. This is one of the reasons why these group of diseases have been neglected from national or global health authorities. And also entities, parasitic entities are prevalent in underdeveloped and developing countries in most cases. So it is another reason. So my talk will be focused on 5 kinds of parasitic entities occurring in Asia, mainly based on my own experience in Asia, particularly Laos, PDR, and Cambodia, and Africa, like Tanzania. Yeah, I will talk some for that. Okay, first topic I would like to mention is schistosomiasis. This is called blood fluke disease. It includes at least more than 5 species: Schistosoma japonicum, Schistosoma mekongii, Schistosoma mansonii, and Schistosoma intercalatum, and another one, Schistosoma hematobium. These 4 species causes liver cirrhosis or ascites or esophageal varix, and particularly pot belly. And Schistosoma hematobium, it causes the bladder, urinary bladder diseases, causing bloody urine, cystitis, and sometimes bladder cancer. So you can see this is the real worms, male and female worms of the schistosoma. And this is the egg of Schistosoma japonicum and egg of Schistosoma mansonii. This is a big spine, lateral spine here. And this is the egg of Schistosoma hematobium, having the terminal small spine. And the 2 worms, male worms and the female worms, are embracing together to make looking like just one worm, but it is actually 2 worms, male and the female worm is embracing each other. And this disease is distributed geographically, mostly in African continent, you can see here. But in Asia, we have also a lot of endemic areas, including China. Is around the one big river, Yangtze River. Big endemic areas are still present, and the Philippines, part of the Indonesia, and also Laos and Cambodia. That is Schistosoma mekongii is prevalent here. And very recently in Myanmar, where previously the schistosomiasis was unknown, but very recently Shan State and Rakhine State shows some occurrence of schistosoma, maybe mekongii or some related species or japonicum related, and also schistosoma hematobium or related species have been recently found. This is one egg found by our group from the fecal examination of the people from Shepidar around Yangon city, Myanmar. So this is a kind of emerging disease in Myanmar also. Okay, this slide shows the patient from China, Schistosoma japonicum, who has a very big belly, and this is the endemic area of Schistosoma mansonii in Tanzania, and this is Schistosoma mekongii in Laos. They are walking and washing their clothes here or playing around this water place, and the children are playing in this small river or lake. And Schistosoma mekongii patients from Cambodia, you can see this one patient is a very, very big belly with with the very the varix, abdominal varix. This person is Schistosoma mekongii patient, but he is much improved after praziquantel treatment quite many times. And then he is recovering from the Schistosoma mekongii infection. And okay. This slide is to show Schistosoma mansoni patient from Kome Island from Tanzania. It was taken in 2013 by our group. He has the big belly, and this person is actually a man, but because of the liver dysfunction, his breast look like the woman's breast. And this is the Schistosoma hematobium, bloody urine here from the school children. They have a urine contains blood because of the bladder schistosome. This boy is we met him several years ago. He is suffering from Mansoni infection in around the Kome Island, Tanzania. He has much difficulty in breathing. So we asked him, what is your most difficulty? So he replied us, I'm very difficult in breathing. So we can imagine how this child is sick and he is suffering from this very, very bad illness. And he has a very big belly, and this child is living actually in this uh, small cottage, like it's his living room of this boy. So we are very surprised. He is from a very poor house. Okay, I move another group of the parasitic entities. This is lymphatic filariasis. Mostly three species are involved. For example, Wuchereria bancrotrophics and Brugia malai and Brugia timori. Brugia timori is particularly found from the Timor Island of the Indonesia, and the Brugia malai is scattered all around the Southeast Asia. And the Wuchereria bancrotrophics is also present in Africa and also in Asia, many worldwide distribution. This is a patient from Tanzania. We saw this patient in 2006. He had a difficulty in moving his to very enlarged legs, but he could ride a bicycle very slowly, but managed to take bicycle and came to our uh, center. And this patient is from Korea, uh, found in year 2000, so some 20 years ago, by myself. However, this patient looked like the last person patient of the Brugia malai filariasis in Korea. After this year 2010, maybe year 2006 or 7, the eradication was declared from the Korea, the lymphatic filariasis. It was reported by myself. Okay, this is to show the world distribution of lymphatic filariasis. You can see African countries and South America, and also many Asian countries has the filariasis, lymphatic filariasis. Okay, now moving to soil transmitted helminthiasis. It is very common and actually very important, the group of neglected parasitic disease. The major species involved are Ascaris lumbricoides, hookworms, for example, Ancylostoma duodenale and Nicata americanus, and Trichuris tracura, the Strongyloides coralis. These four kinds of the soil transmitted helminths are most important. They can cause nutritional deficiencies, retarded growth, anemia, diarrhea, and abdominal discomfort. So 3 billion people are infected globally. Another species, Ancylostoma silanicum, has been recognized as another emerging important species of hookworm infecting humans. This is the Ancylostoma silanicum. This worm was found by our group in Cambodia. Okay, now I see Ascaris lumbricoides adult worm is moving like this. It is a pair of worms, female, and this is the male worm. And three types of egg. One is fertilized egg, another is unfertilized egg, and this one is embryonated egg containing the larva developed inside of the egg. And this is to show the three leaves on the head part of the Ascaris lumbricoides. Okay, this slide shows the from Korea a long time ago, almost 60 years ago in Korea, we had a high prevalence of Ascaris lumbricoides, and this is to show one picture. The small girl is defecating here in front of the vegetable garden, and if this a child has infected with Ascaris, then the eggs of Ascaris lumbricoides can put into this vegetable garden and contaminate all these the vegetables. This is one kind of a latrine, traditional latrine used in Korea a very long time ago. Now, the most of the latrine in Korea has is changed into the water flushing modern system. This is the at that time 60 years ago I took this photo. This is just around this toilet. The vegetable garden is here. And you can see the Ascaris lumbricoides worms. Uh, they are put together, and they make a kind of a ball, which was surgically removed from a child patient in Korea. Left is the group of male worms, and this is the female worms. Sometimes we could see this kind of heavy Ascaris lumbricoides infection in Korea, but in Korea now, we cannot see this heavy infected patients. Just some very few people infected with Ascaris now. Okay, two important species of hookworms infecting humans, as I told before, Ancylostoma duodenale and Nicata americanus. This is to show the hookworm. This is hookworm also. They are sucking blood in the mucosa of this duodenum or small intestine and making anemia if the patient is heavily infected. This is to show adult female and male of Ancylostoma duodenale, and this is the egg of hookworm. The egg of Ancylostoma and the Nicata is difficult to discriminate one after another, so we usually call this one hookworm eggs, commonly called this one. And you can see the buccal cavity of the Ancylostoma duodenale having two pairs of the teeth, sharp teeth, and the Nicata americanus that has a cutting plate, one pair of cutting plate here. So they can be discriminated at the adult stage. But at the early stage, they cannot be discriminated. Okay, now I move to foodborne trematodiasis. Foodborne trematodiasis, many kinds are involved like this: Clonorchiasis, Opisthorchiasis, Parasitologists, Echinostomiasis, Lecithodendriidiasis, Heterophyiasis, Neodiplostomes, Gymnophalloidiasis, Plagiorchis, numerous species are involved, but mostly they are neglected. Uh, this is the show the adult form of Clonorchiasis removed from the rat after experimental infection. Okay. Okay, this slide is showing the Clonorchis, Opisthorchis, two kinds of liver fluke. Clonorchiasis is distributed in China, Taiwan, South Korea, and Vietnam. But Opisthorchis viverrini is distributed in Thailand, particularly in the northeast part of the Thailand, including Khon Kaen and some other areas, and the Laos around the Vientiane and Savannakhet, and even in the Pak Se area and Vietnam. Also in Cambodia, our group found some places of the Cambodia, including Krache province and Dak Kaeo province, is quite prevalent. The prevalence is low, but around 5% or so. But the endemicity is found by our group. Opisthorchis felinius, it is endemic in Russia, eastern part of the Russia. The area is quite big, but the number of people infected is quite low compared with viverrini or Clonorchiasis. These are the symptoms, particularly cholangiocarcinoma is the major clinical problems and complications. You can see the Clonorchiasis adult form and the Opisthorchis viverrini adult form. This is the Opisthorchis viverrini from collected from a Lao adult patient. Okay, this is to show the WHO map of the Opisthorchiasis and Clonorchiasis. You can see this is all Clonorchiasis area, including China, Korea, Vietnam, and some areas of the Philippines. And this is the Opisthorchis endemic areas. This is Opisthorchis viverrini area, including Cambodia, Laos, Thailand, and some part of the Malaysia. This is Opisthorchis felinius endemic areas, very big area of the Russia and the Eastern Europe. This is the Metacercaria, and this is a kind of a fish intermediate host. This is to show the Metacercaria of Opisthorchis from the muscle of the fish, freshwater fish. We compressed the fish of the fish flesh, and then we could see this moving Metacercaria. This is the traditional foods of the Thailand and Lao PDR, kind of koi pla and som, blah, blah, som phak, many kinds of the traditional food, which can be the source of infection with the Opisthorchis viverrini. I met many patients of Opisthorchis viverrini. She is one of the patients in Laos. She living around the Vientiane area, and she is sick with the Opisthorchis. And he is also, he was once diagnosed as a cholangiocarcinoma, but now he is quite good, looking good. He has been treated with praziquantel and also some other anti-cancer management. Yeah, at this time he looked fine. he is the almost a terminal stage of the Opisthorchiasis patient. Unfortunately, he passed away about 1 month after I visited this patient in Vientiane at home. Okay, I move to Paragoniomyces. Paragoniomyces is many kinds can infect human, but in Asia, 4 species are known: the Paragonimus westermani, Paragonimus scriabini, and Scriabini miyazakii, and Paragonimus heterotromus. These 4 kinds are distributed around this area, including Japan, Korea, China, Vietnam, Thailand, Laos, Cambodia, and also Philippines and India, many Asian countries. Okay, this is to show the Paragonimus westermani adult worm, and the egg in sputum is a golden yellow color, quite big egg, and the pulmonary infection showing this cavity lesion by the Paragonimus worm. And this is another is an ectopic location of Paragoniomyces in quadratus lumborum abdominal muscle has the Paragonimus granuloma and making many kinds of symptoms in a Korean patient. Okay, this is to show the first intermediate host, and second intermediate host is crab and crayfish, and these are the Metasulcaria of the Paragonimus westermani collected from Korea. Okay, I move to Echinostome species infecting humans. You can see many different species involved, at least more than 10 species involved in the human infecting Echinostome infection. I would like to talk just one species, Ismiophora hortensis from Korea. Okay, this is Ismiophora hortensis worm, adult worm from collected from human infection, and this is one of the fish intermediate host containing the Metasulcaria, and this is the egg found in the fishes of the patient. This has the operculum here and the abopocular wrinkle here, and quite a typical shape of the egg in the from stool. Okay, this is many worms collected from just one Korean patient. The worm number was 649 worms of a heavy Ismiophora hortensis infection. After deworming, he looked very happy and very active again. But during infection with this parasite, he was usually bad abdomen and bad digestion, abdominal pain, and sometimes diarrhea, many symptoms. But after praziquantel treatment, the symptoms were much improved. Okay, Lecithodendriidiasis, also a very minor intestinal fluke infection, including Capri Morgorchis mollencampi. Previously it is called Prostodendrium mollencampi, but now the genus has been changed like Capri Morgorchis. The Phaneropsilus bonnii and Phaneropsilus spinocidus is the two species reported from Thailand. Spinocidus is particularly from Thailand. The bonnii is Thailand and Laos and also Indonesia. This is the worm specimen of the species. This is the source of infection with the Lecithodendriid trematode. You can see this is the larva of the dragonfly. Some local people is consuming this kind of a food sometimes undercooked or almost raw. They eat this kind of larval dragonfly and infected with this Lecithodendriid trematode. The many works published from the Thailand parasitologists. Okay, heterophyte flukes, also numerous species are involved, the infecting human patients. Among them, I would like to briefly mention on Haplorchis tytri and other species, and Heterophyius nocens and heterophyes. Also Metagonimus, 3 species. Briefly, I will mention. Haplorchis is this one, Haplorchis tytri. This is prevalent almost all areas of the Asian countries, Southeast Asian countries, including Thailand, Laos, Vietnam, Cambodia, also in southern part of China also, and in many parts of the India also. Another one, Haplorchis familio. This is prevalent in Asia and also in Egypt, the northern part of Africa. Quite recently, our group found this worm and egg from the Tanzania. Is the quite southern part of the Egypt. From some children, school children, has this kind of parasite infection. Haplorchis yokogawa is another species, and our PDR, a lot of species of freshwater fish are involved in the transmission of this kind of Haplorchis infection. Heterophyes has particularly Heterophyes nocens is prevalent in South Korea and Japan, and Heterophyes, and dispar and equalis. This is not in Asia, but Heterophyes was reported from India, but other species is only from Middle East and Egypt. Gastrointestinal troubles are caused by this worm, and this kind of fish is the intermediate host. Okay, Metagonimayasis. These 3 species is known. Metagonimus yokogawai, Metagonimus miyatai, Metagonimus takashii, and Metagonimus minutus. Yeah, four species are known in Asia, and they can cause gastrointestinal troubles. This is yokogawai, this is miyatai, and this is takashii. A little bit different in the morphology. And this is the distribution map of the Metagonimus in South Korea. You can see many numerous endemic foci has been discovered by parasitologists in Korea. Still no much change in the endemicity has been recognizable. And this is the worms, very tiny worms, just 1 millimeter, 1 millimeter. Very small worms from just one patient has this kind of more than 70,000 worms were harvested from just one patient. And you can see this, the fisherman is very pleased with the two freshwater fish. It is a kind of a sweet fish. Sweet fish is kind of a freshwater fish is migrating from the river, and they are transmitting the Metagonimus worms in Korea. Okay, another group, Neodiplostomiasis. It is very particular in South Korea. And also this parasite was reported from China, Jilin province, just reported from a rat. But in South Korea, we found many human patients infected with this trematode. The trematode is look like this one. And this is the entire worm. For 79 specimens were recovered from just one patient who had eaten this kind of snake, undercooked. And then 5 days later, he developed acute abdominal pain with fever and high eosinophilia. And he had to visit the hospital. And then he was found this egg in the stool. And then we recovered the adult worm using bithionol anthelmintic, and then make some diarrhea. And from the diarrheal stool, we collected 79 worms like this. Okay, Gymnophalloidiasis. This is another new, quite a new parasite, Gymnophalloides seoi. It was first named in 1993. Our group, this is myself, and the first human case. After then, a small village, whole village people were found infected with this new parasite. And there are several more new endemic areas which was reported by our group. And gastrointestinal trouble, so pancreatitis and diabetes were complained of by the patients. This is the Metasocarea of Gymnophalloides, which was from the oyster. This is the oyster worm, oyster fluke. This is an egg in the Cadogats, and this is from concentration technique. And in the mummy of the intestine, some 400 years ago from Korea, numerous eggs of the Gymnophalloides were found, suggesting that this Gymnophalloides seoi was present at least more than 400 years ago in Korea. But we couldn't find more than 400 years whether this is infecting humans or not. Okay, this is to show the adult worm of the Gymnophalloides, and the intermediate host, the oyster, and you can see the Metasocarea grouped, look like a white tissue spot. This one is the white tissue spot. Many Metasocarea here. So if you eat just a couple of the oyster raw, then you can be infected with more than 100 like that, and you can experience with the gastrointestinal troubles. Okay, I moved the last topic, Taeniasis and Schistosomiasis, which is quite emerging from the many trees. Taeniasis is caused by 3 species of Taenia, including Taenia solium, Taenia saginata, and Taenia asiatica. And Schistosomiasis is so far known only caused by Taenia solium eggs. And if human eats the egg of Taenia solium, then in the human body, Schistosomiasis may develop. The scolex part of Taenia asiatica is look like this, 4 circles, and is a flat rostrum. And you can see the specimen, also this one. And the Taenia solium was also found in Korea, but now it is very difficult to find. We think the Taenia solium has been almost disappeared from Korea, but we have to confirm. There are not so definite the evidence of the disappearance, but we couldn't find Taenia solium for longer than 10 years, 20 years, no cases of Taenia solium. But Schistosomiasis cases still very few cases, but it is quickly decreasing in the prevalence. Okay, Schistosomiasis is infection with metastacestole of Taenia solium, and cysticercosis may infect in this subcutaneous tissue of human, and when it is surgically removed, the host tissue, and inside this one, the cysticercosis is lower, can be seen. And the cerebral cysticercosis may be developed in humans. You can see the cysticercosis here and here from the brain city. Here also. So far I have mentioned many kinds of neglected parasitic tropical disease, and which is prevalent in the various localities of the Asia. And I have the pleasure to introduce some of them. Thank you very much for your attention. Thank you.
Okay, thank you very much.